That's really the issue here. The conservatives, they want significant deficit reduction, and they have a good point. I mean, the US federal government right now is running an annual deficit above $2 trillion. I think it's projected to go up to, 2.5 or $2.6 trillion, by the end of the next decade. So we're talking massive deficits. They've been called by a range of experts as unsustainable. But the question is, where are you going to get the savings to really do this? And what the House Republicans have identified is Medicaid. Now, of course, this is primarily for poorer people, and I think the calculus is that basically poor people don't have the same megaphone to complain about cuts. Now, of course, Social Security and Medicare, that's something that all Americans benefit from, and that's why they're staying far away from that. But the problem is that the biggest drivers of the deficits, or the debt for that matter, are Social Security and Medicare. And Medicaid is already, if you talk to Republicans on Capitol Hill or members of both parties, Medicaid is already, running on a shoestring. I mean, and I think the problem is that, and I think what the Republicans think is a problem is that many able-bodied Americans are being covered by Medicaid. They want to shift it more to people who are truly disabled and, impoverished youth. But the question really becomes, how much savings can you get from Medicaid before you have consequences like rural hospitals closing? And so that is really the rub here. Social Security and Medicare, too politically powerful to touch, yet they're the biggest drivers of the deficit. Medicaid services primarily lower income people. They don't have the same political clout in Washington. But how much can you really cut before you start seeing significant consequences on the state level? Someone is going to have to pay these bills at some point, and if you just shove those costs onto the states, there are going to be problems around the country.
You talked about the opposition to Medicaid cuts from moderate senators like Lisa Murkowski and Susan Collins, but you also have somebody like Josh Hawley who's been fairly critical of these cuts. I wonder if you think that signals a kind of a cross section of the Republican Party from the more moderates to maybe like the MAGA base that could make it, again, more difficult to find that right balance when it comes to cutting or paring down the social safety net programs.
Well, Hawley is very conservative, but he's a populist conservative, and he is someone who has kind of staked his political reputation on defending, the working class Americans. And so he is, a Republican in the MAGA mold. But he's been very outspoken. He does not want to cut benefits because he realizes, and I'm talking about Medicaid benefits, he realizes that if you impose greater cost sharing requirements on people earning between 100% and 140% of the federal poverty line, you're going to wind up hitting a lot of working class Americans. And that is not going to be popular either in blue states or red states. One of the things we're realizing here is that, red states benefit a lot from Medicaid. And now the Medicaid expansion under the Affordable Care Act, some states chose to expand, others didn't. But there are a number of red states that chose to expand, and it has helped, increase coverage in those states. So Josh Hawley and there are other Republicans from the Midwest or the West, Jerry Moran from Kansas, for example, they're worried that if you cut Medicaid benefits, it's going to impact their constituents. And there have been studies that show that if you even require a $35 copay for medical service, fewer people are seeking medical care. And so that begins to snowball. If people aren't getting medical care because they don't want to pay the $35 copay, they may not be staying healthy, and they may wind up in the hospital. And then who ends up bearing the cost of that? Well, ultimately, the hospitals do. So it's a very complex problem. But I think what's becoming clear here is that Medicaid has become, or has been for years, it's an essential service. It deals with elderly nursing care. It deals with impoverished youth coverage. It covers the disabled. And if you cut these benefits, you're really creating a problem for these states because the problems don't go away. I'm talking about the healthcare needs of the constituents don't go away. So that is why you even have very conservative or fairly conservative senators stepping in and saying, no, we can't do this. Let's figure out another way to reduce the deficit. Or, maybe we need to take a closer look at raising corporate taxes, which has been on the table, although it didn't make it into the House bill.
House Speaker Mike Johnson warned the Senate not to change the bill too much. He's dealing with his own delicate balancing act between conservative and moderate members of the House. As the Senate takes up their part of this legislation, do you think they are kind of ignoring what Johnson said on that and really going their own direction?
Well, I think the senators know in the back of their minds that, if they make changes and send it back to the House will be, under a lot of pressure to accept whatever changes the Senate makes. And, the other wild card here is the X date. That is when the federal borrowing authority needs to be increased. That's when we need to raise the debt ceiling. That's projected to happen at the end of July. So what I expect is that the Senate is going to be, spending the next 6 weeks on this bill, making changes, and they're probably going to send it over to the House, right before that deadline to raise the debt limit. Of course, this legislation includes language to raise the debt limit another $4 trillion. It's likely to be increased to $5 trillion once the Senate gets finished with it. But I think what the senators who are looking at making big changes to this bill know is that if they send this bill back to the House, before the deadline to raise the debt limit, Trump is going to be very impatient to get the bill passed. He's going to put pressure on House Republicans just to accept the bill, and that's probably what they're going to do. So I think it's almost like a basketball game. The team that has possession of the ball in the final 30 seconds and it's a close game, they're probably going to win.
Yeah, and as we've seen in the past, President Trump very influential with those House members and often able to corral them at the moment when it seems like, a bill could possibly be on the cusp of failing. So it'll be interesting to see what happens there. Alexander Bolton, thanks so much.
Thank you.